Okay, I think we'll get started. So first of all, hello everybody and welcome to our webinar. I'm just burned out, or am I? A clinical perspective for lawyers presented by Dr. Tracey Meyers, and I will introduce her shortly. We're so glad that you're here with us today. I'm Amy Levine, Director of Programs and Volunteers, and I'm going to be your host for today. Before we begin, I always like to remind people what we do. So we provide confidential and free services for the legal community, and these include one-on-one consultations with licensed clinicians for mental health and substance use concerns, peer support groups, educational programs, and consultations with our law practice advisor on firm management and professionalism. A few housekeeping tips. We do love engagement, so please feel free to submit your questions using the Q&A or chat features, and we'll do our best to address them. And now I'd like to introduce my esteemed colleague, Dr. Tracey Meyers. Dr. Meyers is a licensed clinical psychologist with over 25 years of experience in neuropsychology assessment and psychotherapy. Before joining LCL in 2020, she spent 17 years with the Connecticut Department of Mental Health and Addiction Services, serving as a clinical neuropsychologist and later as Director of Behavioral Intervention Services. Tracey is a certified yoga therapist, advanced yoga teacher, and mindfulness instructor. She's written extensively on integrative medicine and positive behavioral support treatment. She is the author of Yin Yoga Therapy and Mental Health. She also serves on the board of Mindfulness and Law Society and promotes well-being in the legal profession. Finally, she is a co-facilitator of the Mental Health First Aid Certification Training. And without further ado, I'd like to hand it over to Dr. Meyers.
All right. Thanks, Amy. So nice to have you here with me and joining as my moderator and poll expert.
We'll see.
Yes. Yeah, I'm really excited to talk about this topic because it comes up so often about the question of burnout versus depression or anxiety. So we're going to talk about that today and hopefully also allow you some time to contemplate of where you are on this journey or continuum, because I think we all can relate to, especially the feelings of burnout. So I'm going to start by just beginning to share my screen and slides. Okay. So why is this important? So of course, lawyers report really high stress exposure on a regular basis. And this idea of burnout has become kind of a catch-all term. Like we just say it very like kind of offhandedly. Oh, I'm so burned out, right? It's just a very common thing we say. But we don't always actually know what it is, right? So we use that term sort of like stress, right? Where it's a catch-all, but knowing and understanding it has a lot of nuances. And if we don't get it right, or we maybe are incorrectly labeling ourselves, we may not get the support we need. And that's one of the themes you're going to hear throughout this talk today is like figuring out what is happening to make sure that the intervention matches what's actually going on for you. This key idea, though, burnout is not a mental disorder, right? We're talking about distinct things, even though there is a lot of overlap between signs and symptoms of burnout and something like a clinical depression. So that's why we're going to spend time really looking and teasing apart the differences between these terms. Okay, here's our poll. So right before we came on, Amy and I, truth be told, we were like, how do we do a poll? Oh, and Amy did it already. Okay. So here's the question. Have you felt burned out in the past year? And so if you can please vote. Have you felt burned out in the past year?
We're getting a lot of responses.
Great.
Seems to be slowing down. So,
Okay.
Tracey, is it okay? We end the poll?
And the poll. Yes.
Okay.
Okay. So the answer is 87% said yes, 8% no, and 5% not sure. Yeah. Okay. So, we're in good company, right? And kind of recognizing with our colleagues that this is very common. That does not surprise me. And those of you who said not sure, that's also really important because as we go through this today, you may actually have more clarity about that. All right, so let's define burnout. Let's get really clear on each of these terms to understand ourselves and also people we're working with, right? So the World Health Organization actually has a definition for burnout, and they classify it as an occupational phenomenon. So it's not a medical or psychiatric diagnosis. It's directly linked to work. It results from chronic workplace stress that has not been successfully managed. So it's work specific, right? Work specific. Because I think sometimes we start to broaden it to include lots of other things happening in our life, but the ideology, the beginning of it is related to work. So what it looks like. So here's where it gets tricky, right? Because it can look like depression, energy depletion and exhaustion, feeling alienated, excuse me, negative or cynicism toward the job, and reduced professional effectiveness. These are really common signs of burnout. And what are things that, and there are more, we'll go through more, but I wanted to give you those three first. So, what are things that can contribute? So, it can start with the work environment itself, not feeling supported, or there's a lack of fairness. The workload becomes unmanageable, insufficient acknowledgement or recognition of efforts or work, lack of control, lack of input into daily work, and then the personal life demands. So that's where this outside of work can sometimes overlap. So, what does burnout in the law look like? And some of you may relate to some of these: dreading client calls, irritability, emotional numbing, fantasizing about quitting, reduced patience, avoidance of tasks or avoidance of people. And again, there are more, but these are some of the categories. And so, those of you who answered yes to the poll, you might notice that you have one or two or three of these that tend to be how it most shows up for you, right? Um, we could add lots of other things here, but these are some of the broad categories. And one of the things they have in common is avoidance and emotional reactivity, right? Either numbing out or getting more irritable. So again, kind of saying in different ways, but so burnout is about your relationship to your work. It's not about self-esteem. It's not about, your particular constitution or emotional makeup. It's about your relationship with work and how it impacts you. All right, so that's kind of our first category that we're going to define. So how do we know when it's not burnout, right? And so we're going to look now at more of if we think about burnout on one end and then the continuum of a mental health crisis on the other, when stress turns into a mental health challenge, right? So when does it change from being related to my relationship with work to my relationship with myself? So first of all, let's look at how pervasive mental health challenges are, right? The NIH talks about how about 1 in 5 US adults struggle with mental illness, right? So that's 1 in 5, 23% of the adult population. And if you look at the categories here, anxiety, the most common, followed by depression, PTSD, etc. So it's just helpful to look at these statistics to kind of recognize, of course, legal professionals are right in the middle of all of this, right? So it's common anyway, 1 in 5. Now we know the lawyer data, but I'll show you anyway, because you probably know this from many of the reports that we've all shared over the years. But we'll go back to our NORC report from 2023. The lawyer data is even higher, right, in terms of anxiety, depression, and suicidal ideation. So if we see here 26%, so that's a bit higher than the regular population, right? Depression higher than the regular population. And we can go on and look at the levels of burnout. So consistent with our poll, right, as well. So lawyers in general, and we found in Massachusetts specifically in this report, have higher rates than the regular population. So it's not uncommon to be struggling with a mental health condition as a legal professional. And it's not uncommon to have burnout. And it's not uncommon to have both. So of course there are going to be those of us that struggle with both burnout and a mental health challenge. So, how do we know when it's not just burnout? And I use not just because, of course, sometimes you could have both, or sometimes it may start out as burnout, but it is turned into a mental health challenge. So, let's just think about these questions for yourself, right? So, the question is, do I feel this only about work? If the answer is yes, then that usually gives you a really clear indicator. It's one of the first questions I ask when people come in for a consultation. Do these feelings of anger, irritability, feeling like numbing out, avoidance, does that just happen when you're at the job? And when people say yes, that makes it a little bit easier. With the mental health challenge, the answer is no. It extends much further. Does it improve when you take time away from work? And again, with burnout, usually, although not always, but usually, and with mental health challenges, often not, right? And that can be very discouraging. Do you get joy outside of work? This is really important too. When you're experiencing burnout, it may be a little bit diminished, or you may not have time as much to do some things that you enjoy, but you still generally appreciate and enjoy the things that you do outside of work. But with a mental health challenge, it's often diminished significantly, right? So there's a big shift. Nervous system. Does your nervous system feel constantly on? Does it feel aroused? Does it feel distressed in different ways? Do you feel anxious? Do you feel like that physiological keyed up feeling? So with burnout, sometimes. With a mental health challenge, often. In fact, more and more often, where there are less times where you feel relaxed and at ease. And then hopelessness. With burnout, rarely, right? With mental health challenges, it's more common, especially in depression. So let's take a look at some of these categories now to see, again, where do we fall on this continuum of burnout, burnout leading into a depression, or a full-blown depression. And so these are some of the symptoms that are common with depression. You don't have to have all of these to meet the criteria. And it's a little bit tricky. Sometimes when you look at some of these symptoms, things like sleep, weight loss or gain, energy, or even kind of like slowness in thinking, we don't always attribute that to depression. In fact, we don't usually, right? Anger outbursts, we don't usually think, well, that means I'm depressed, right? So we can call these more atypical but common symptoms of depression that can make it difficult to know that you're actually experiencing a depression. And so it's helpful to realize that you don't have to have all of these, and for you it may show up much more physical in the body. And for some people, it's very classic sadness, tearfulness, frustration, etc. When it approaches a major depressive disorder, we're talking about a pervasive low mood lasting at least 2 weeks. So it's a discrete period of time. Most people, let me just go back to the slide for a second. Most of us have experienced these symptoms, throughout the year. We can experience them for a day or two or three, or even up to a week. But to make the criteria for a major depressive disorder, it has to be at least 2 weeks. So it's ongoing, right? It doesn't just go up and down day to day. Ongoing, pervasive low mood for a period of at least 2 weeks. There's a lack of pleasure in activities that one used to enjoy, sleep and appetite disruption, hopelessness, cognitive impairment, again, getting to that slowing down of our brain. We call it psychomotor slowing when it's attributed to a depressive disorder. And then we can get into some of the cognitions, possible suicidal ideation or plan. Also other symptoms, including sadness almost all of the time, tearfulness, etc. So burnout versus depression. So thinking for yourself, again, burnout affects your relationship to work, but depression affects your relationship to your life. Let's just pause with that because that's kind of a helpful, very easy way of thinking about it in some ways. Burnout affects how you're relating to work, but depression's affecting how you relate in your own life. So here's an example for a legal professional. Burnout is like, I can't wait for this case to be over. And depression is, I can't remember the last time I look forward to anything, right? So if we're talking to two lawyers and both are, on the same case, one might say, oh, I can't wait for this to be over. And the person that's struggling with depression, it's not, it's so much more global than just that case. All right, let's turn to our most common mental health challenge, which is anxiety, as we saw from the World Health Organization and the NIH. very common, about 18% of the general population, and lawyer data showing it's often closer to 25% or more. So anxiety is a tricky one also because anxiety has both a physical or physiological component and a cognitive component. And for some people, they feel anxiety physically predominantly. Nervous, keyed up, heart racing, sweaty palms. So all of that sympathetic nervous system arousal, that can feel extraordinarily uncomfortable. And for some people, anxiety is much more a cognition, having thought loops going over and over again about a particular worried situation. It could be anticipatory about the future, or it could be rumination about the past. It can relate to an impending sense that something terrible is going to happen. Um, and it can affect sleeping, eating, concentrating. One of the hallmarks of anxiety is avoidance. And we see this often with legal professionals where if you're anxious about something, you tend to avoid it. And when you avoid it, you temporarily feel better. It's like, okay, I'm not going to think about that. I'm not calling that client back because that client's going to really be upset. So I'd rather not. And when you avoid, when you do an avoidance behavior, you feel better initially. But of course, the next day or the next time the client calls, that feeling actually increases. So there's often an avoidance cycle that can happen with anxiety that actually increases the feelings of distress over time. So there's lots of different kinds of anxiety. The most common is generalized anxiety disorder, which extends into multiple areas of life. It can be very difficult to control, often has some of the physiological components that we talked about earlier. Panic disorder, so that again is very common, can have an extreme physical distress symptom for someone. They may even think that they're having a heart attack, for example. It can be very frightening, intense fear. And then social anxiety disorder, which is much more about in relationship to other people, feeling like embarrassed or feeling judged, feeling like you're going to have, you could faint in front of someone when you're public speaking. So it's a lot about the social reciprocity that's happening. And that can lead to avoidance because it feels so uncomfortable. And then specific phobias, which are very common, can be an intense fear of a specific object or situation. And the fear is in disproportionate relationship to the actual danger. For example, I have a specific phobia of mice, little mice. And so, yeah, if I see a mouse, I tend to like jump on it, literally will jump on a table. Now that is not, not in relationship actually to what that little mice can do. The good news about phobias are we can avoid them as much as possible. And so they tend not to impact our life as much as the other categories do. And they're easier if you want to get treated. The treatment's a little bit easier for a specific phobia. All right, so here's the question to think about for burnout and anxiety. Burnout, you feel depleted, right? When you're burned out, it's depleting. When you're anxious, you're overactivating. These are very simplified. I don't want to, make it sound like it's just this very, very cut and dry, simple explanation. But I think in terms of seeing where burnout and some of these mental health challenges start, it's helpful to check in with yourself. Like if I'm feeling more depleted on a regular basis from my work, that's likely to be burnout. But if I'm feeling anxious and keyed up and it's really extending, ongoing, that's a signal that this may be more of an anxiety condition. Here's another classic example for legal professionals. When you're feeling burned out, it's like, I don't want to even open my email. And when you're anxious, I've checked my email 10 times in the last hour, right? And so just kind of see where do you fall on that? What typically happens for you? All right, we're coming now to the third most common mental health condition, PTSD or post-traumatic stress disorder. It's a mental health condition triggered by a terrifying event, something that feels, and is very life-threatening or dangerous. And it can occur either experiencing it or witnessing it. Symptoms can be flashbacks, nightmares, emotional dysregulation, a lot of alterations in arousal and reactivity in the nervous system, uncontrollable thoughts about the situation, avoidance. You see some of the same overlap with anxiety. And then we have this other category, which many lawyers struggle with around vicarious trauma. And we sometimes call it secondary trauma or vicarious trauma. And it's very similar, and it can impact our nervous system in a similar way, maybe not to the degree of actually being in a situation which was life-threatening or actually directly witnessing. But for many attorneys, there is a vicarious trauma that happens hearing people's stories. So we talk about immigration attorneys, for example, or public defenders, or anyone who's working with people that have had trauma or experiencing trauma, child and family lawyers, right? And so over time, hearing other people's trauma can create some of the same dysregulation in one's own nervous system. So here's a little bit more about secondary trauma and vicarious trauma, right? Therapists also can have this as well because we're hearing people's stories. Um, and so the idea of indirect exposure to trauma, secondary trauma is the most common for professionals like legal professionals, lawyers, and psychologists. Vicarious trauma can affect anyone who's exposed over time to traumatic content, right? Watching the news ongoing, right? You can experience vicarious traumatization. And so there are support strategies. We're going to get much more into this for the second half of the presentation, but this idea of peer support can be super helpful in addition to therapy. So if we think about burnout versus PTSD or secondary trauma, burnout, you feel really exhausted, right? You can feel just tired and done with work. And trauma is this persistent activation, right? It can be fairly unrelenting for people that are experiencing it, that their system is persistently activated, and it could be overreacted or it could be shut down, but that the nervous system never feels at ease. With anxiety, our nervous systems are always keyed up and activated. With trauma, with PTSD and secondary trauma, our nervous system may be going back and forth between hyperarousal and hypoarousal, but it's always activated. We're rarely in our window of tolerance when we are experiencing PTSD or secondary trauma. There's always some kind of difficulty or alteration in our activation level. So it's really uncomfortable. All right. So here's another way of thinking about burnout versus PTSD or secondary trauma. Burnout is like, I don't want to deal with this case anymore. And trauma is, I can't stop thinking about this case. And we hear this a lot in our work when it could be one case or it could be multiple cases that are so distressing, it can create a traumatic response. And one case can do that. One case can do that. So just a lot of compassion for yourself. And anyone experiencing PTSD or secondary trauma is extremely uncomfortable and distressing. Okay, so let's kind of look at this little table to think about where we fall on the different spectrum of burnout, depression, PTSD. So I'm just going to go through it. We'll look at each column and think through what are hallmarks or key differentiators. So to burnout, our primary trigger is the stress of the job. So it's relationship with the work. So it's specific to work, emotional exhaustion and cynicism, energy level low often, capacity for joy, yes, outside of work usually. And on vacation, does it get better? Often, yes. Okay, so that's our burnout. Depression is multifactorial. It may actually, for some of us, have nothing to do with the job. It could just be genetics, or a combination of life and stress and grief and loss. And so there's many, many different factors. And it's pervasive across different life domains. The core experience is often a feeling of hopelessness, despair, loss of pleasure. Energy levels often low or slowed. That gets to that psychomotor slowing that we see. And this is often what's happening in the brain. I do want to say that too. When we're talking about depression, we're also talking about the neurotransmitters in the brain, working with a couple of different neurotransmitter paths when someone is experiencing depression, which is why there's a physiological component to it. Capacity for joy is reduced. Anhedonia, lack of pleasure, or a lot less pleasure in one's activities that they normally enjoy doing. Does it improve on vacation? Often no, or maybe briefly, right? And then PTSD. So the primary trigger is exposure to a traumatic event, direct or secondary. Is it specific? No, it usually has more of a generalized impact. And then this is more about that dysregulation, either the hypo or hyperarousal. Energy level can alternate. Capacity for joy often blunted or restricted, maybe not completely, but there's maybe a bit more limited. And then not reliably improving on vacation. Sometimes yes, sometimes no. And then anxiety disorder. So often the trigger is a perceived threat, uncertainty, or a loss of control. But that could be an imagined threat, right? So it could be just like, oh, if I open my email, I'm going to get bad news today, right? That could be a very, it may not be true, but it's a perceived fear. It has a more generalized impact. The core experience is chronic overactivation in the nervous system and excessive worry. Energy level can be like feeling wired, but also tired. So it could be kind of that, a little bit of both. Capacity for joy is generally still intact, but it can be overshadowed by worry. I'm sure we can relate to you're doing something fun and all of a sudden a worried thought crosses your mind and you're like, right, in that moment you're taken out of the enjoyment. And then improves on vacation temporarily. If you really remove a lot of the stressors, you can feel better, but it's like more of a temporary relief. All right, a couple more I want to go through. The sleep pattern for burnout improves when we're away from work. Cognition, reduced focus related to the overload. Emotions, often irritability or detached, can feel tired. Avoidance is very common. Suicidal ideation, rare with burnout, it's just rare. Alcohol use can be common with burnout, right? Numbing after work, right? Increasing use of substances around not wanting to think about work or to get rid of the stress. Depression, the sleep patterns can be very different. Early morning awakening, insomnia, or sleeping too much, hypersomnia. Cognition, that slowed thinking, more negative thoughts. Sad or emptiness, appetite changes. Social withdrawal, suicidal ideation can be common, especially more moderate, severe, major depressive disorders. And alcohol use, certainly, substance use, self-medication for mood. PTSD, sleep can definitely be disrupted, insomnia, nightmares. Cognition, there's a hypervigilance or intrusiveness in thoughts. Could feel on edge. There's more startle response or muscle tension. Could be avoidance of things that remind a person of trauma or clients or situations. Suicidal ideation can happen with PTSD and trauma. And yes, self-medication for the hyperarousal. Finally, anxiety disorders can be difficulty falling asleep or staying asleep, racing thoughts, tense, restless apprehension, physical, a lot of GI, rapid heart rate, muscle tension. So there's a lot of physical symptoms with anxiety. Avoidance, like we talked about earlier. Suicidal ideation, possibly. And then self-medication for tension, right? We see this a lot. So these are, again, not exactly clear cut, but can give you a sense of where you might be falling on the spectrum from between burnout and another condition. And I want to say too, we can have co-occurring conditions, right? So often people have an overlap between all three of these, right? So you might have one that's more predominant. And how do we know that? Well, sometimes we just start treating one and seeing how someone is doing. For example, if someone's coming in and we've identified it's not burnout, but it's much more likely to be a combination of depression and anxiety. They may see a psychiatrist, for example, and look at medications. And if they respond well to an antidepressant, then we have a sense that, okay, yeah, maybe it's supporting that piece. And sometimes medications help with all three of these as well. And therapy, of course. Okay, so this we're going to kind of summarize where we are. So burnout is tied to this depletion with work, improves with real time away. There's a sense of cynicism and exhaustion, but joy is still possible outside of work. Depression, loss of vitality, anhedonia, hopelessness or self-critical thinking not fixed by vacation. PTSD, we're stuck in threat mode, intrusive memories, hypervigilance or numbing, avoidance of reminders, and anxiety, persistent overestimation of danger, right? Racing thoughts, difficulty relaxing, and relief is temporary. All right. So I'm going to pause here and see if we have any questions or comments. All right, let me see. Okay, I see.
We do actually have a question.
Great.
This person asked, where might a constant feeling of being overstimulated fall, especially in someone who has anxiety and might not always be worried about something specific, but feel like they have a short fuse or no bandwidth left?
Yeah, it's a great question. And it's kind of like in the middle, right? Where we're seeing it can be, I mean, one of the questions I would ask would be like, does it feel like it's explicitly tied to work, or are you noticing this is happening in the same way with, things outside of work? And that's sort of that's one of those things that's helpful because some of the symptoms can feel the same way, right? Feeling overstimulated, feeling worried and anxious. But if you notice that doesn't extend into home life, I would say that falls more in the burnout. If it's more extending into daily life on a regular basis, even when you're away, I would say it falls probably more into the anxiety category. The short fuse and no bandwidth, right? Like that can fall into all three of those things, to be honest, right? And I think we all can relate to that when we have a short fuse, that irritability that can be part of depression, can be part of trauma. It's really like what's happening in our nervous system. So when we say we have no bandwidth, I'm thinking, oh, our nervous system is so overactive, right? When you feel like I can't do one more thing or that small thing set me off, that's when we recognize that our nervous system's been in an aroused state. So to me, like I think that those are some of the questions to ask yourself.
We do have a few more questions.
Sure. Yeah.
This person did say the slides are fantastic and thanks for everything so far. So the question is, if alcohol or substance use are not an issue, can overeating be an outcome or something someone does with the four topics we're discussing?
That's a great question. Yes. And so when I think about substances, or we call it more like different coping behaviors, right? Because they're really coping behaviors. And absolutely. So overeating, it could be scrolling, it's anything that provides us relief. And that activity can sometimes have deleterious effects, right? Like if we're overeating and, we don't feel well in our bodies, or if we're scrolling and we end up can't go to sleep at night. So yeah, absolutely. I think for all of us, we probably could name two or three or four different ones that we might, struggle with as a way to cope. And that's where I try to bring in a lot of self-compassion and not judgment, more like, oh, I'm looking for something to soothe myself because I'm feeling distressed versus why am I doing that? That's bad. I think it's really important to look at any coping mechanism starts out as adaptive because it helps us to calm down. Over time, it can become maladaptive if it's hurting ourselves in some way, but we want to be really kind to ourselves and think about why we're doing it. So, yeah, it's a great question.
So we don't have any more in the chat. There are a few
Oh,
questions that I think we can save to the
okay,
end.
sure.
But
Okay,
somebody did ask if you could show the last slide that
sure,
you just had up there.
sure. Okay. Well, I just see in the chat too, someone wrote,
Oh,
some of the language regarding symptoms sounded a bit fixed or permanent. Is that the case, or is full recovery and a return to your old self or a more resilient version to be possible? Oh, yeah. That's a really helpful question to ask. It's never fixed or permanent. And I love that idea. And that's what I like thinking about the nervous system versus a, a character flaw or something we did wrong or anything fixed. The nervous system is really malleable, right? And our brains are too, right? If you think about neuroplasticity, the whole other conversation we could have. But this idea that we absolutely can learn and change how our nervous system responds to things with supports and with skills, right? So absolutely. And I love what you even hinted at, which is like more resiliency. Absolutely. So that's, one of the reasons why these kind of topics are so important because it's not just like, oh, well, now I realize from this presentation that I'm depressed or I have secondary trauma. It's like, oh, if I do, what can I do to actually recover and become more resilient? So, great question. Yeah. Okay. And yes, I will go back. Okay. All right. So here's this one. And we're going to send these to you also, just to let you know. Okay.
and for folks, this is being recorded, and so you'll receive the recording right after the presentation, and then it will be housed on our website as well.
Okay. All right. So these are three questions to ask yourself. So, as we're thinking about what's happening, so is this only about work? Yes. Likely burnout? No. Consider a clinical. Can I still feel joy anywhere? Yes. Again, burnout may be more likely. No. Consider, and maybe it's more related to depression. And does my body feel constantly on edge? And that kind of goes to that initial question someone asked today. And the answer, yes, consider anxiety or trauma. Okay, so we're going to do a couple of case vignettes so that we can apply this and think about it for ourselves as well and our colleagues, right? So David is a 44-year-old litigation partner at a large firm. Over the past year, he's reporting being increasingly irritable with associates, dreads depositions, fantasizes about leaving the law, feels emotionally numb in client meetings, sleeps well on vacation, feels noticeably better after long weekends, still enjoys golf and time with his kids. He says, I'm completely burned out. I just need a long break. Okay, so is this burnout, depression, anxiety, or trauma? What's your best? You can just put it in chat.
Somebody mentioned burnout. Oh, we're seeing a lot of burnouts.
Burnout or trauma. Okay. Good. All right. Great. Burnout. Also, maybe anxiety. Okay. Awesome. All right. And so, I like that you're all thinking of some of the nuances of this too. So it's most consistent with burnout, right? It's work specific, some of the key indicators, improves with time off, preserve pleasure outside of work, no pervasive hopelessness. So our teaching point here, right, in this one is burnout is in the context of depletion, right? So it's really the focus is this depletion that improves when he's away. Now, that's not to say that he doesn't have anxiety. He may, and there may be some trauma that may be happening independently, but from what he's reporting in this case, most consistent with burnout. And so if someone were to come into the LCL and talk to us about this, we would probably, well, we're going to get to strategies in a moment, but we're going to focus on burnout prevention strategies. Okay, here's our second case. We have Beth. Beth's a 38-year-old family law attorney. Over the past 3 months, feels exhausted at work and home, no longer enjoying running or seeing friends, wakes up at 3 a.m. most nights, feels like she's failing everyone, increasingly tearful in private, says even if I quit law, I don't think I'd feel better, reports drinking 2 to 3 glasses of wine nightly to take the edge off. All right.
We already have some answers coming in.
Okay.
Depression.
Burnout, depression, anxiety, or trauma.
And lots of depression answers.
Okay. Okay. Yeah. So most consistent, we're seeing some, I mean, again, we're not actually diagnosing. We're not supposed to, we're not doing a true psychiatric diagnosis, but it's most consistent with the depression, the major depression, pervasive symptoms of anhedonia, sleep disruption, hopeless cognition. It's not work specific. And then that self-medication emerging with the substance use, right? So we're seeing that this is lasting. And that's the other piece too. When we start to hear that it's been lasting for at least 3 months here, right? So she's been experiencing that. It's not just a transient, a couple of weeks or less. All right, let's continue. So we have Andre, who's a 50-year-old public defender. In the past 6 months, he's represented multiple child abuse cases, has intrusive images from trial testimony, feels on edge, snaps at his spouse unexpectedly, avoids certain case types, trouble sleeping, says I feel different, like my nervous system is stuck. But he says it's just burnout. Everyone in my office feels this way. What do you think for him, Andre? Trauma, vicarious trauma, trauma and anxiety, secondary trauma. Yeah. Because of the intrusive thoughts. Yeah. Vicarious trauma. Yeah. Great. Secondary trauma. Good. Yeah. So most consistent with secondary trauma, PTSD spectrum, we're getting some of the intrusions, hyperarousal, avoidance, nervous system dysregulation, and not simple exhaustion. But here's where it's tricky with Andre, right? Because He says, it's just burnout. Everyone in my office feels this way. And that's one of the challenges. That's like why we're doing this today, because it goes back to this idea that we can really minimize and normalize feeling this way because we know other people do feel this, but that doesn't mean that it's not secondary trauma. It just means other people are also experiencing it. And in Andre's case, it makes sense as a public defender that other people are feeling this way. So we can get comfortable with feeling uncomfortable, and almost that normalization can preclude us from getting the support we need. So even if you know many people struggling, then you know many people struggling just like you, but it doesn't mean that it's just burnout. All right. So, why does everything become burnout? Well, there's a way that it's like socially acceptable. It's a lot better in some legal professionals' minds, lawyers' minds, to say it's burnout because we have this mental health stigma that continues to be pervasive. And we talk about this all the time at LCL, like how important it is to try to normalize and destigmatize. And so when we have terms like burnout, it's tricky because yes, it's good to talk about burnout, of course. And if we are using that as the catch-all and not actually going below that, people aren't going to get the help they need. So it preserves one's identity. In fact, it almost preserves one's identity as a hard worker. If I'm burned out, that means I'm working really hard, right? Um, and so it can almost be like a badge of honor to be burned out because you're working to the point where you're exhausted. And the other thing is that burnout suggests it's temporary, but as we know, it may not be, right? That's it can actually lead to a challenge over time. The other piece is that people often can mask very easily. Lawyers are really good at this. They can continue to bill, they can continue to go to court, they can perform okay. They kind of leave everything, at the office. And by the time they go home, there's so much internal suffering that they're using substances or really just there's a collapse, there's a nervous system shutdown. So because lawyers tend to be very high functioning, it makes it easier to mask or to live with some of these mental health challenges, even if someone's profoundly struggling, or we're seeing it show up in other ways outside of work. So what do we do? Right? Let's get to the heart of actually what we do. And burnout is important too. So I'm not minimizing this, but want to talk about both strategies for burnout and then for some of the mental health challenges. So, what actually helps if it's burnout? So, the idea of burnout is is really it's a mismatch. There's something with you and the work environment that's not working. And maybe it worked at one point, but it's not working as well. So, we're going to go through these categories about like what actually helps when it is more of a mismatch between the job and you, right? Essentially, burnout improves when the environment changes, not just when we cope better. And that's important too, because we often think, well, I just have to learn coping skills if I'm burned out. But if we don't touch anything happening in the environment, it's a repeated cycle, right? We might feel better temporarily if we start doing mindfulness practice, right? We feel a little better, might feel a little less reactive, but it's still this mismatch and some of the same things, lack of control, lack of support, not getting recognized. That still happens. And over time, even the best coping skills are less effective. So we'll go through each of these categories. One is this workload calibration, which is not like working less, which would be nice, right? But it's like, can we reduce the intensity, right? And some of this is our own self-imposed, right? The unrealistic timeline. Sometimes it's not self-imposed, and we actually don't have a choice in these. But if we have a choice in any of these, this may be a starting place, right? Which is like redistributing things that are more draining to different times of your day, or just balancing your own caseload if you have too many cases of one certain kind that are really difficult. If there is a way to do a shortcut where there's less overload administratively, right? Is there anything to delegate? And then this unnecessary friction, right? If you have to drive 2 hours to go to a certain court, right? Is that something that your colleague could do because your colleague lives closer? We can have those kind of conversations with different people in our job office too, right? That can make a big difference. If you have a colleague that's much closer to a place than you are, that would be reducing the friction to have that colleague take that case. But we often don't ask that because it feels like, oh, I'm imposing on my colleague if I do that. But if there's a shared agreement, then it's a lot easier. So that's what workload recalibration means. And even picking one small piece of any of these can make a small difference. The boundary repair, right? The simple thing of taking your email off your phone, right? And just really recognizing I'm not going to do it after 6 o'clock. Not having a real day off because you're checking emails. So that accessibility is huge. Um, that's just one of the biggest things we can recommend. And you'll hear us say this in different presentations because it's just so vital for our nervous system. If you tend to get burned out or run anxious, every email is going to create a little mini distress response. Even when it's a positive email, it's going to be a little jolt in the nervous system. Just getting a notification on your phone causes a response. And so shutting that off at a certain point, clarifying availability, differentiating urgent versus non-urgent demands, creating your own system and letting people know what that is. Like I'll respond within 24 hours, 48 hours during working hours, whatever that is, right? And so boundaries aren't about like being hard and fast, but it's more about what helps you sustain what you're doing. Autonomy restoration, right? And this goes back to that idea of not having control, of your job or lack of control and choices. So research shows this over and over that people are happier, especially in legal professions, when they have more input on their schedule, when they can do some remote versus in person, right? And have some control over that. Input into cases, more decision-making authority, reducing micromanagement. So control buffers stress, and the smallest little changes around autonomy can make a big difference, particularly time, right? And the other piece is we actually do need to recover because if we don't recover, like that's why vacation like really is important because if we don't have those times where our nervous system can recalibrate, it becomes harder and harder. And then we are more likely to have a more prolonged and or turn it into a mental health challenge. So we need true psychological detachment from work. That's easier said than done. I know. But it can happen. Physical rest, non-competitive activity, it can be competitive as long as it's enjoyable. I'll add that in. But something that you really enjoy. And social connection that's not centered on work. Preferably people that are not in the biz with you, right? That you can actually just, be yourself in a different context. And then thinking about values again, and this can be very helpful. And I often ask lawyers this question when I'm meeting with them, like what drew you to your work? What part of your work still feels meaningful? Where are you acting out of obligation versus meaning and purpose? And are there any adjustments that would increase a sense of meaning? We know that when we feel like what we're doing matters and has meaning, we are able to tolerate lots and lots of stress. It's when it stops feeling meaningful, right? That can, cause cynicism, moral injury. We could go, that's a whole other side topic as well. So meaning buffers stress and value, and when values conflict, that can accelerate burnout, right? So good to ask yourself. And this often helps. I've asked lawyers who will come in and say, I want to quit. I want to leave my job. I don't like it anymore. And if we go through these questions, we actually can sometimes tease out, oh, this is more burnout. This is because of these factors. And often that can be very relieving that you don't have to quit your job. It's just there are some things that have gotten off, out of balance in terms of the work you're doing. All right, what do we do when it is a mental health challenge or it's a combination of burnout and anxiety, depression, or trauma? And so it's really important, especially with depression, that we start to look about, and we're talking about like major depression specifically. We want to talk about a combination of therapy and often medication, right? Especially when symptoms are more moderate to severe. Evidence-based therapies, there are many evidence-based therapies that are very helpful. Cognitive behavioral, mindfulness-based strategies, ACT, acceptance and commitment therapy, to name many. And there's many other combinations. Helping people with sleep and alcohol stabilization, and finding meaning again in an activity. Really, really important. You're not going to vacation your way out of depression. It doesn't, it needs treatment, right? And so that's where we want to help people. That's where the catch-all, it's just burnout can get us in trouble because that's not going to help when someone is really struggling with a clinical depression. If it's anxiety, again, therapy, cognitive behavioral therapy, mindfulness, exposure-based interventions that help people tolerate distress in their nervous system using a systematic process to do that. nervous system regulation skills, which there are many of them, breathing, movement. There's lots of different ones we could get into, and medication when appropriate. Interestingly, with anxiety disorders, it's key to work on decreasing avoidance because the more we avoid, the more it actually makes the anxiety more hardwired in. So anxiety improves when we can work on decreasing avoidance to task. Secondary trauma, again, this is nervous system regulation. It's not about a weakness. It's not about something being wrong with anybody. Trauma focused therapy is really important to see a therapist that has a specific trauma background because there are trauma therapies that are researched and recommended, EMDR, CBT, prolonged exposure. It's a way of processing intrusive material, helping with sleep and hyperarousal, reducing isolation. And so we really want to support that nervous system. And really, in all of the three conditions, particularly trauma and anxiety, the nervous system needs help. It just sometimes gets off, right? And it's hard to regulate. Okay, so if we put it all together, we think about burnout and changing our relationship to work, changing the structure in some way if we can. Depression, we're treating our mood system. Anxiety, we're retraining our threat system and the nervous system. And trauma, there's a lot of processing and helping to regulate. So there's different solutions and there are different mechanisms that may be impacting. And of course, we can have more than one. So I don't want us to think in discrete categories, but more about making sure we're inclusive of all of these categories when we're thinking about ourselves or colleagues. All right, so questions to ask yourself when you start to notice any of the symptoms we're talking about today. Is this only about work? Does it improve when I step away? Has my capacity for joy changed? Am I more irritable or numb than I used to be? Am I relying on alcohol or drugs or substances? We can substitute food or scrolling, whatever, to help me cope with my stress. And then we want to take care of our instruments, right? I think about like we normalize burnout, we normalize ridiculous amounts of stress as legal professionals, right? And how do we like make this instrument sustainable, right? So we know that if we feel better after rest and boundaries, that really helps. So we want to adjust our structure for that. And if it's following you home, we want to make sure we're seeking support for our mood and for our nervous system. So even though we get used to feeling the way we do, we normalize the way we do, we want to really be careful of our instruments so that we're not running on empty. So sources of support. So seeking out support is really important. So you can consult with us. Of course, you all are here already, so you know about our services. But you can meet with us to get help, and we do consultations. We help refer into the community. We have peer support opportunities and groups. We have lots of resources for different conditions. There are many mental health professionals, right? And so really helpful to either go through your EAP or find, a trusted friend who might have a therapist referral. But if you struggle with that, go through Lawyers Center for Lawyers because we can help you with that. And then trusted colleagues and family and friends. I mean, the connection really does help. So if you're talking to someone who's in a similar situation, it can bring down some resistance and not feel like you're alone. So I don't want you to wait until you're in a crisis. And think about this, taking care of your mental health, this whole continuum from burnout to depression and trauma. It's really about protecting yourself. Your instrument is your judgment, your competence, relationships, longevity. And we talk about this all the time, that you want to have a full career, no matter where you are, if you're at the beginning, middle, or end of your career, you want to really feel like that is protected. And so using support as a strength to maintain, your vital profession. All right, so that's the end. I want to see if we have time for questions and comments.
So first of all, thank you, Tracey. This was once again an amazing presentation. And just to reemphasize, you don't need to figure it out what the issue is. Certainly reach out to us, go to our website, schedule a consultation with one of our clinicians. And then also, Tracey has done a number of presentations on nervous system regulation. So please go to our website, our digital library, can type in polyvagal theory. That is one of the great ones that, again, talks about regulating your nervous system. We do have some questions. So, what is a good way to address burnout issues on your team when firm leadership expressly discourages systemic changes that would improve problems? So, mandating 24-hour email availability, purposely minimizing staffing, etc.
Yeah, I mean that goes right to the heart of this, right? So I like as a team. I mean, I think it is helpful as a team to be able to ask for requests as a team together. First, to be able to validate and speak about it openly and honestly, so that people you don't feel like shame or that like you're feeling this and not talking about it. So talking about it collectively really does help. And then yeah, seeing if you can approach. I mean, that's really difficult, right? That's where the system makes it really difficult for you all. I think the research backs this up, so it's kind of like showing the research to firm management too, having people continue to talk about it, having webinars like this where people, you can talk to your HR about having a burnout well-being conversation. So bringing information in, that's one suggestion. That's exactly the crux of the issue, right? For so many lawyers.
Right. Excellent. And somebody else again asked, how do we talk to supervisors or managers about the burnout and vicarious trauma? So I'm not sure if this person is asking specifically about the individual themselves approaching their own supervisor or manager and talking about it and how it's impacting them.
Yeah, I mean, I think it's like a good regular conversation to have with supervisors and managers, like even asking that, like, how do we address that here, or can we have a conversation about this, or what kind of formats can we talk about this on a regular basis? Because I mean, it's not new information, but the more that people are actually talking about it, some of these things like can seep into the culture, like around, schedule issues or the email accessibility. So I like the idea of just asking, not like can we, but how do we
Mm.
bring in, programs related to burnout and stress.
And as Tracey mentioned, we again do customized programming. So I am the person to reach out to, Amy at lclma.org, and we can organize something, a customized program specifically for your organization. There is a question out there, and I think this is specifically to Tracey in general, in terms of do you do neuropsych testing to diagnose for autism and ADHD?
I don't. But we definitely can help you, to find resources for that. So yeah, I have in the past, but I don't currently at LCL. Yeah.
Okay. Um, we also have another question. This person asked, what about too many billable hours? Airline pilots have limits on their flight time. Is there a way to approach this as an environmental issue in terms of better norms? That's a
I mean,
big question
it's a
and a
great
tough one.
question. I mean, I love that hour. I love that question because it's like, yes, um, everyone is different in terms of their capacity, right? And there are people that have cognitive capacity, attention span. Maybe they don't have a as much of a challenge in work-life balance where the billable hours make sense for them. But for most people, it's really hard, right? For most people, it's really hard to be able to do that. The answer is we absolutely should, and yet there continues to be pushback around that. And we know this with firms. There are some firms that actually increase the billable hour demand depending on as people move up, right? So that the answer is we should and we need to. And without that, we leave lawyers very, very, very vulnerable to these conditions that we're talking about today.
And I know there are firms out there that are trying to address some of these issues. One of the topics that used to be talked about that is coming back now is a flat rate fee for clients. And that again changes the culture a little bit with billable hours. Again, it's in discussion. It is a very difficult culture to change. But there are firms that are thinking about it and giving you billable hour credit when you take a vacation. And so again, thinking about ways to help, but it is still a great challenge out there. Again, we're getting some thank yous for this amazing program. Always so helpful. And If there are any other questions, we are more than happy to answer them, although we're right at 1 o'clock. Again, more thank yous. But please feel free, reach out to any of our clinicians. Again, go to our website to schedule a specific time with them. And if you do want us to come in for customized programming, reach out to me and we can talk a little bit more about with your managers and supervisors on this topic.
Thanks, everybody. Really appreciate everyone's questions and thoughtfulness and and continuing to try to build ways to improve people's experience at work and reduce burnout. So really appreciate it and hope to see you again soon.
Thank you again. Thanks
Thanks,
for
Amy, for
joining us.
moderating as well.
Thank you, Tracy. All right.
All right.
Bye-bye.
Bye, everyone. Take care.